Okay, so hello and welcome to one and all. A heartiest good evening, and I welcome you all to another episode of the Breast Cancer Awareness Series, an initiative of Integrated Health and Wellbeing Council being powered by Dr. Reddy's. So, this very insightful discussion, we will be discussing on the topic of Armed with Knowledge, essential questions if breast cancer touches your life. And for discussing the same, we are very happy to have very renowned doctors here with us. I welcome Dr. Safalta Bagmar, who is Senior Consultant with Amrita Hospital, Faridabad. Ma'am, thank you so much for joining. We welcome Dr. Sushant Mittal, who is Associate Director of Max, Shalimar Bagh, New Delhi. Sir, thank you so much for joining. We're so glad to have you.
Likewise.
I welcome Dr. Piyush Bajpai, who is Senior Consultant with Manipal Hospitals, Delhi. Sir, thank you so much for joining. So glad to have you. I also welcome Dr. Abhishek Kumar Singh, who is Head of Medical Oncology and Hematology with Globe Healthcare, Lucknow. Sir, thank you so much for joining.
Thank you. Thank you for inviting.
I also welcome Dr. Devesh Goyal, who is Senior Consultant with Fortis Hospital, Jaipur. Sir, thank you so much for joining. Great. So we welcome all our esteemed panelists, and we welcome you all to this very special discussion on breast cancer awareness. As October is recognized as the Breast Cancer Awareness Month, this series that we are doing along with Dr. Reddy's is to equip the audience with the essential knowledge around breast cancer so that we can clear away the myths and know what the facts are around this problem. Breast cancer is one of the most common cancers worldwide, and it is affecting millions of lives. Early detection is the key for successful treatment and improved survival rates. And by raising awareness and educating ourselves, we empower individuals to take control of their health. So let's get started. My first question is to Dr. Safalta. So, ma'am, let's start with the fundamental questions. Everybody wants to know what causes breast cancer in them, what makes a woman more susceptible to get breast cancer. So can you please help us understand what are the risk factors for breast cancer and what steps can those individuals take to lower their risk?
Good evening, everyone. So this is a very important question. Carcinoma breast cancer, we have two types of factors that can cause breast cancer. One set of factors are which we cannot control. That is being women. You cannot control it. And males also can have breast cancer, but their chance is much lesser than female. So being women, increasing age. Yes, with the age of 50s and 60s, the breast cancer increases. But then one should also know that there is the incidence of breast cancer has doubled up between age 20 to 40 as well. Then third part is if there is some atypical changes, something happens in some people are having some more than benign changes in the breast that can also lead to breast cancer, which is also not in our control. And there are females who have early menarche. That means their period starts before the age of 12 and they are still menstruating till 55 years of age. That means their hormone exposure, the female hormone exposure is quite extended. And that can also cause cancer. This is also not in our control. And if there are some genetic mutations, some hereditary genes running in the family that can cause breast cancer, these are the things which we cannot control. But there are certain facts which we can control and we should know about it. First is being overweight. One has to do exercise, regular exercise, keep a check on the weight. This is one important thing which we can do. Second important part is you should eat more of a vegetable diet, less of a meat products, so that it will be a protective effect. Vegetable diet, high fiber diet, they have some protective effect. There are females who don't have pregnancy because of some reason, or they have pregnancy but after age of 30 years, and there are females who have kids before that, but then they are not able to breastfeed even It can be because of professional commitment, or it can be because of some hormonal issues that they are not able to lactate. All these females, they have certain increase in the risk. It is not about a female who never had a child or had not breastfed, they will develop breast cancer. It is not like that. But these factors, they have some protective effect. If you have child, if you have multiple children, if you have breastfed well at least a year, then in that case, it has some protective effect. Then limiting alcohol intake, because the moment it is like daily alcohol intake, even a moderate amount of alcohol, that can cause breast cancer. So these are the factors that you can control.
Thank you so much, ma'am, for discussing all the risk factors. So, ma'am, there are few, just carrying on onto the same aspect, there are few risk factors that people feel are, present. We are not sure if these are myths or facts. So, can you please help us clear them? One is any injury to the breast. They feel that if they get any injury to the breast.
No. There are females who had breast lump, but they did not feel about it. They did not check. They did not do self-breast examination. But because of injury, they incidentally they touched their breast and they found that there is lump. So it is not because of the injury. It was there already, and they did not see before.
Okay, ma'am. Thank you so much. And also, two more. Some of them feel that certain types of bras also lead to breast cancer. So how true is that?
No. None of the type of bra will cause this thing. But then it is also said, like, it is not, if you wear this kind of bra, then you will have breast cancer. It is not like that. There is some sort of rare association that wired bra, if you use for long time, it may cause some tension, some inflammation in the breast, because it is very tight, and it causes some discomfort, and persistent discomfort may cause some issues. But it is not like it has been studied and it has been proved. It is not like that.
Okay. And ma'am, there's also another thing that people suspect is getting breast implants. So how are these related? Are these related?
No. There's no increase of risk by using breast implant.
Okay. Thank you so much, ma'am. We will get back to you again. I will take the next question from Dr. Sushant Mittal. So, sir, we discussed what are the risk factors. Can you please talk about some of the signs and symptoms of breast cancer that individuals should be vigilant about, so that and are there any lesser known signs that people should also be aware of?
So this is the most common question which is asked by the relatives of the patient when they come across in our OPD. And also in our awareness talks, what I tell them, that any painless lump in the breast should be evaluated. People or females try to think that if it is not painful, it is nothing to worry about. They, because of the stigma, Sharma Sharmi, for whatever reasons, they don't tell the husband, or they don't tell the daughters or the son or any family members, and they don't let us know. And then it grows and it infiltrates the skin or spreads to the bone, then it causes pain, and then they come and show it to us. The most important is any lump in the breast, whether it is painful or whether it's not painful. Most important, if it's not painful, then more chances that it may be cancerous. It needs to be evaluated. Second is any uh, puckering of the nipple. Puckering of the nipples means that the nipple has retracted. It has become out of shape. Both the breasts are not symmetrical. One breast is larger than the other. The shape is not symmetrical. If there's any blood discharge from the nipples, then one should get evaluated. And in the armpits or on into the neck, if they feel any lump, then these are the early sign and symptom one should be aware of. Self breast examination is one of the most common thing which one should learn. Anyone can Google or YouTube it and see how it is done, and you can feel the lump. If you feel anything suspicious, if there is swelling in the skin, if there is some pitting on the skin, then one should get it evaluated.
Thank you so much for sharing these signs and symptoms, sir. On the same note, we wanted to know that most of the people, as they do not know that males also can get breast cancer. So if they do, are the signs and symptoms of male breast cancer different from that of female, or is it similar?
So male breast cancer most commonly presents as a lump in the around the nipple, and one should get it evaluated. Most of the time it is again painless, or sometimes it can be painful, so one should get it evaluated. Many a times it is because of some blood pressure medicines that you might get some tenderness in the breast or some lump in the breast, but one should get it evaluated to find out what it is.
Thank you so much, Dr. Sushant. We will come back to you. My next question is to Dr. Piyush Vajpayee. Sir, the term early detection is often emphasized in breast cancer awareness by all the clinicians, but most people are not aware what this really means. So can you please help us understand between the difference between the terms screening and detection? One. And can you also please explain why catching breast cancer in its early stages, as it is said, is so vital for positive prognosis and treatment outcomes?
So actually, screening and early detection are basically catching up cancer early. So what Dr. Safalta spoke on was preventing cancer. So these are certain lifestyle modifications. That is not having a cancer cell flourish in the body. But early detection or screening, on the other hand, screening is a broader term. Early detection are methodologies. So screening basically picks up very early or very small stage cancers, very small size cancers. And there are methods for every cancer subtype. Not all cancers are screen detectable, but there are certain cancers. And basically, breast cancer is one of the predominant ones where we talk about screening. Well, screening, as we understand, is very important, where a cancer can be screened, should be screened, because by catching a cancer early, of course, you catch it early in an earlier stage, and it, of course, results in a better outcome in terms of survival, in terms of treatment responses. So not only this, but you can probably cut off another modality of treatment also if you catch up the cancer earlier. So not essentially that you might end up giving chemotherapy or radiotherapy to every cancer patient. Therefore, you could just get away with one modality. So that is the importance of catching cancer early. One is to improve the survivals, and also to actually just get down to one or two modalities of treatment. The other thing is that you asked is whether there is a real benefit and how is it like screening helps. So we understand that in India, we are seeing nearly 2/3 of our breast cancer patients in our clinics. They present in very advanced stage. They present in locally advanced or advanced stage. So 2/3 of them are presenting like this. Whereas if we see in the Western world, where screening is a part of a health checkup and their insurance would be updated only if you are on the screening program. So there, 2/3 are presenting in the early stage. Rather, 3/4 are presenting in the early stage. And therefore, these translate into the same number of survivals. Whereas in our country, we are losing at least 50 to 60% of our patients to breast cancer. Each year, almost 1.6 lakh ladies are being diagnosed, and we are losing at least 80,000 or 90,000 ladies to this disease. So it's almost half the percentage that we lose. We lose because we are seeing patients in very advanced stage. In West, they are not losing patients to breast cancer now. It is very minuscule number that they lose. They do lose, but then it is in a figure of 10 to 20%. So because the fact is that they are actually doing it, a catch of early stage breast cancer, and therefore these mortality rates are lesser.
Thank you so much, sir. We will come back to you for more discussion. My next question I will take from Dr. Abhishek. So, sir, for our viewers who may not be familiar with breast cancer screening and the types, etc., could you explain the various methods that are available? And what is the frequently recommended screening method?
See, everybody has discussed about what is the importance of screening. We all know just now, Dr. Shafalta has mentioned about the risk factors. So we know there are some risk factors, defined risk factors. So there are people who are at more of risk, and there are people who are not at risk, increased risk, but they should be having a screening test to be done at a routine time interval. So why we are talking about screening, and to make people aware, whatever we are doing right now is to make them aware. Awareness is the key for any screening method, for any treatment outcome, better outcome. And we all know that cancer is curable when it is diagnosed early. So basically, the importance and the actual purpose of doing screening is to detect cancer at the earliest time frame when it has started developing or just started or early stages, so that we can cure the disease. So there was a paper a few years back by Professor Margaret Chang, and it was published by WHO that 40% of cancers are preventable. So I mean, prevention, if we take the steps at the earliest, we can prevent some cancers also. So there are risk factors. Definitely, Dr. Safalta has already elaborated what are those risk factors, and there are some general for the general population. There are some recommendations when we should do the screening. So we usual recommendation, NCCN and ACS, they say that every female of age 40 after age 40 should be screened with mammography annually. That is a recommendation. And we also recommend people to have the self breast examination. Females can mark on calendar every month after period. Once period is over, every month they can do the self breast examination, especially after 40 years of age. Everybody should be doing it routinely. If they feel anything suspicious, they should definitely go to doctor as the earliest possible. If they are not feeling anything after age 40, every female should go for a annual mammography, which is a kind of X-ray we take, and it can give us the what are the percentage of any suspicious lump or any suspicious growth, which can be a cancerous malignancy thing or any suspicious thing. And we have the grading for it in the X-ray. We define it is called as BI-RADS, and based on those BI-RADS scoring, we further recommend for investigation like FNSC and biopsy for those suspicious breast lumps. And for clinical breast examination, every female after 40 years of age should be doing this screening method, and every 3 years they can go to the for the clinical breast examination. If there is nothing is found in their breast examination or mammography, for once in 3 years they should go for clinical breast examination as well. And there are some high risk patients where there is some genetic or familial history is there. Then those patients also should have some MRI test, which is a kind of radio imaging for the breast examination, and those patients are to be screened by MRI apart from the mammography. So these are the routine recommendations for breast examination screening.
Thank you so much, sir. We will come back to you again. My next question is to Dr. Devesh Goyal. So, sir, we often hear about breast cancer subtypes, but most of the people are not aware what those subtypes are in breast cancer. All they know is mostly cancers are, the last stage, the first stage, second stage, like that, but they do not know about the types. So can you, such as, HER2 positive, triple negative, etc. So could you please explain in simple language to our audience what those common types are? And could you also, help us understand how these types would impact the treatment decisions?
So yeah, thank you. So I think previous speakers have explained about the risk factors as well as the screening detections method as well as symptoms. So now, after all these modalities, so now we are focusing on the types of breast cancer. So routinely there are two types of breast cancer. I think in which IDC, invasive ductal carcinoma, that is the more common. So more common, 90% of patients presented in this IDC. The second subtype is the invasive lobular carcinoma, that is the ILC. So there are the two main subtypes, and rest others are very rare subtypes, medullary, mucinous. There are other very rare subtypes. So I think the types are these types, and we are doing the biopsies to know the tumor spectrum, the ER, PR, as well as the HER2 status. So we are finding the three. We are deciding the treatment based on this ER, PR, as well as HER2. So suppose few patient can presented with this ER, PR. These are hormone receptor positive tumors, and sometimes they only present with this HER2 positive. So we can find out this HER2 positive tumors. And third part is all these three are negative. So the third types is the triple negative subtypes. And if all comes to be positive, that is the triple positive subtypes. So definitely the treatment depends on these subtypes, and then we will decide on this staging part. So the staging part is the T and M. The T means the tumor size. Suppose the tumor size is less than 2 centimeters, so T1, 2 to 5 centimeter T2, and more than 5 centimeter is T3, and skin of breast is inflamed, so T4 size. So then the part is the nodal status, so N1, N2, and N3. So based on the lymph node involvement, so we can find out the N1 and N2 and N3, and then M stage. So M indicates to the metastasis. So suppose the tumor is spread to the other organs, suppose the bone, lungs, as well as the livers. So we can say that the tumor is metastatic. So this tumor is called as the stage 4. So we will find out the type of the IDC, ILC, as well as the other subtypes. Then find out the stage based on this TNM. Suppose the T2N0, T3N0, T3N1. So we will decide the further treatment in stage 1, stage 2, stage 3, as well as stage 4. And then the third part is the ER, PR, HER2. So suppose the hormone receptor positive tumors, HER2 receptor positive tumor, as well as triple negative. So if we are coming to the prognosis, so hormone receptor positive tumors are slightly better, good prognosis. Then compared to the triple negative, these are slightly aggressive tumors. So in these situations, sometimes if the tumor is very large, so chemotherapy is required first, and HER2 positive tumors. So these are also aggressive tumors, but nowadays some types of targeted treatment of the trastuzumab as well as the TDM1. So these two drugs are available to treat these HER2 positive tumors, and 1 year duration is required to treat this type of tumors for HER2 positive.
Thank you so much, sir. So on the same note, we will take the next question from Dr. Safalta. So, ma'am, once the diagnosis is made, what are the treatment options that are available for breast cancer, and how the choice of this treatment is determined? Because with the advancements and all the different, advancements in breast cancer that are coming out, doctors, as been shared, are trying to choose the conservative options more and more, so that most of the breast is conserved as much as possible. So can you please explain the audience about these?
So the treatment of breast cancer, it involves surgery, radiation, then chemotherapy, hormone therapy, targeted therapies, immunotherapy. So all these combinations can be given to a patient, but it is decided according to the age of the patient, the general condition of a patient, whether the patient is fit enough to tolerate chemotherapy or not, and stage of the patient. Then stage after that, as Dr. Divesh said, there's some receptors which we put a special ink on the biopsy. So that's why biopsy is very important. We don't treat a patient without the biopsy. So we put special ink, and according to the ink expression, that is hormone expression or some targeted therapy expression, we decide according to that. So it is every patient is different. Every patient's requirement is different. So if there is an initial stage disease, what we do is we generally go ahead with the surgery, followed by that. There are patients who will only require hormone therapy. There are patients who will require chemotherapy as well as radiotherapy. There are patients who will require chemotherapy, target therapy, and radiotherapy, followed by that hormone therapy. So this all treatment is decided based on multiple permutations and combinations. So you should keep a mind open whenever a patient goes to the doctor. They should not compare their treatment with the other breast cancer patients' treatment. It is like every disease is different, every patient is different. Many of the biology, the kind of tumor the patient is having is different. So it is decided according to that. I will not go into detail of each and everything because it will be very confusing.
Yes.
So, but yes, one should know that all these modalities are there, and breast cancer, if detected early, it will be curable. So don't run away from it. And like surgeries, initially it was like whole of the chest wall was we used to remove, but it is not like that now. It is like only the small part of this will be removed, and we have like breast reconstruction surgeries have advanced. So now there will be no change. Nobody will able be recognize that there is some breast surgery has been done or not. And in fact, even if whole of the breast is removed, in that case there are many plastic surgeries are available so that it is reconstructed and it looks the same as that of the original. And you also should know that previously after surgery there was like fullness of the limb, and which people used to call as hathi heart sort of thing. But it is not now, because surgeries have advanced and there are the vessels, they closely knitted and it does not develop. It's now become rare. So you should not run away from it and get all the treatment done.
Thank you so much, ma'am. So I will take the following question from Dr. Sushant. So, sir, we want to know that if the patients have a choice that they can make while these different options are suggested to them for treatment, if there is a choice that the patients can make, and that choosing between lumpectomy and mastectomy, can you elaborate more on this aspect, that the factors influencing these surgical choices and their potential impact on patients' quality of life in both?
So
Yes.
lumpectomy versus removal of the whole breast have given equal results. Sometimes there is a myth in patients or relatives' mind that if only lump is removed, then the chances of recurrence are higher. But if done by a proper surgeon with proper guidance followed by chemo or radiation, the results are absolutely same. However, one thing is for sure, that if the lumpectomy is done, which is also known as breast conserving surgery BCS, one has to definitely undergo a radiotherapy, which may be prevented if one goes under a mastectomy. Maybe, not sure. It depends on the final histopathology. Second, the decision of undergoing a BCS, lumpectomy, or complete removal depends on the size of the tumor and the ratio between the tumor and the normal breast tissue. If the surgeon feels that if after removing the tumor, the normal breast tissue is adequate enough to give the symmetry to the as compared to the other breast, then BCS can be done or lumpectomy can be done. If the disease is limited only to one quadrant of the breast, then it can be done. However, if it is multicentric, satellite nodules are present, then it cannot be done. If the skin involvement is there, then it cannot be done. If it is under the nipple, then sometimes it is possible that areola sparing surgery may be done, but it's not always possible. So if there are various indications for getting the lumpectomy only done versus total breast, these are the main reasons. If suppose there is a BRCA gene, if there is a involvement, or if the family history is very strong, then probably BCS will not be done. The complete breast removal would be advised along with contralateral breast if it is possible.
Thank you so much, sir. I will take the next question from Dr. Piyush Vajpayee. So, sir, there is this aspect of biopsy. Firstly, most people do not understand fully to what biopsy is. That is why I have many myths and taboos around the same, feeling that if they get a biopsy of the cancer done, the cancer is going to spread. So this is a very common running myth. So can you please touch upon that? Also, on the same note, the role of core biopsy, as most people do not understand what it is and what is its role.
Yeah. So you brought up a very excellent point, and most of the patients sometimes who, when they come, one thing they're apprehensive is that if you actually do a biopsy, the cancer will spread. छेड़ोगे तो वो फैल जाएगा. But there is no scientific basis to that. World over, cancer research and medicine have progressed after taking a tissue sample, that is जो कहते हैं टुकड़े की जांच, from the tumor site, गठान से जो है वो टुकड़े की जांच ली जाती है, and then it is studied, as Dr. Safalta had told, that breast cancer is very different once you study on the microscope, once you study it molecularly. It is so different for each patient, and each patient might deserve a different treatment. Not all patients get one treatment. Therefore, it is so important to understand, make a proper treatment chart or algorithm, that how one is going to proceed. Therefore, there lies the importance of biopsy. Sometimes the other misconception is that एक FNAC कर लेंगे या महीन सुई की जांच करने से अगर कैंसर पता लग गया है तो we can proceed with the treatment. Well, that is now, with the knowledge coming in and science progressing, that is also one thing that is going away as a standard of care. The standard of care currently is to establish by a core biopsy. A core biopsy is a slightly thicker needle than a FNAC needle. So, उस थोड़ी सी thicker needle होती है, but after a good local anesthesia, the core biopsy can be done within 5 minutes, and this provides a good tissue to the pathologist to study and give information that which type of breast cancer it will be, and how then the clinician can make a decision how to proceed, whether to go for medical therapy first, that is chemotherapy or immunotherapy, or whether to consider surgery first. So all this is very important to understand the treatment better. And there is no data or science behind the fact कि छेड़ने से कैंसर फैल जाता है. ये एकदम गलत बात है और एकदम जो है ठीक नहीं है.
Thank you so much, sir, for touching on this very important aspect. My next question is to Dr. Abhishek. So, sir, many viewers might be concerned about their emotional and psychological aspects of breast cancer diagnosis. So, can you please shed a light on the importance of mental and emotional support for patients and their families? Because this breast cancer word can be a taboo in the society as well. So many people, just for the from the fear of what the relatives might say, what the society might say, take it very in a different way. So can you please touch upon that?
Yeah, so this problem of psychological and emotional outburst in patients who are having breast cancer is very common, and probably it is not well addressed also. But I'll start highlighting some relevant points, that there are some studies which have shown that anxiety in breast cancer patient is in the range of 10 to 30%. Almost all patients out of breast cancer who are having treatment, out of them, almost 10 to 30% will be having some sort of anxiety. Distress is another important problem which patients are facing. Depression has been, in one study, they have shown that probably the breast cancer is the third most common cancer after pancreatic cancer and head neck cancer, where patients are depressed. And then other problems like post-traumatic stress disorders, because patients are taking a lot of treatment. They have to go for chemotherapy, they have to go for surgery, they have to go for radiation, they have to go for treatment frequently. And then uh, so they can have this post-traumatic stress disorders. Then some patients, they might have cognitive disorders later because of the PTSD, which they can have during their treatment. And then most important is the sexual dysfunction. Females, breast is the most important organ of their body. Once it is being removed, either partly or completely, they will feel incomplete, and that incompleteness will give them more anxiety, more depression, and all these vicious cycle will be there, and they can have this is going to affect their quality of life as well. So, and there is also one of the comparison they have done is in the young patients, they will be more, they will be worried about the disease definitely, then the treatment, then they are losing their breast. That anxiety is more prevalent in younger patients. Older patients, they will be having the cognitive problem and the psychological emotional disturbance will be more in them because of they have lack of social support, and they have to be dependent on their family members for their entire treatment protocol whenever it is going to be there. So all these problems are there, and psychological problem is the most common problem which is more prevalent in breast cancer, and we should be addressing it. There are some risk factors actually which can increase this psychosocial and emotional outburst, and those are like pain. If patient is in the pain, they will be more anxious, they'll be depressed all the time. If there is fatigue, they are not feeling well, they are having poor physical condition, they are going um, every 3 weekly we are calling them for chemotherapy. So all these are the risk factors. And then there is one factor which is financial aspect. They are also worried about the finances, that कि इतना पैसा लग रहा है ट्रीटमेंट में, और पता नहीं क्या होगा, कैसे इलाज होगा, क्या मैं ठीक हो पाऊंगी, नहीं हो पाऊंगी. Then they also have this problem of कि मुझे ही क्यों हुआ, मैंने क्या किया था किसी का. All these stresses they will be having, and because of all these problems they will be depressed most of the time. And also the one of the important thing they are always thinking about is the recurrence, कि अभी ठीक हो गया तो क्या बाद में दोबारा हो जाएगा क्या, या दोबारा होगा तो क्या होगा. So all things, all questions, it will be there in their mind, and they will be stressed about. So what we can do, we can just counsel them. Counseling is very important. We have to tell them in detail कि don't worry, we are there to help you out, and we can also explain the treatment protocol beforehand, so that they will be well aware with their treatment protocols. Also, whenever they feel that there are some correctable changes, like correctable problems are there, we should be addressing them. Like the pain is the most common thing which can give more anxiety. So if there is pain, or if any distress or fatigue, we should be addressing those parts, and along with the counseling, probably we can overcome this problem, which is well addressed, less addressed in clinical practice, because clinicians are busy also in their practice, and probably sometimes we miss a good counseling is very important, and that is should be done from the day one of the treatment whenever we are starting.
Thank you so much, sir. So my next question is to Dr. Safalta. So, ma'am, for those who have undergone the treatment and are now into remission, what are the key aspects of post-treatment care that you would want to share, and how important is survivorship care? So, can you please touch upon this?
One thing which is very important is that a patient who has undergone any treatment, any surgery, chemotherapy, radiotherapy, anything, all the side effects, they go off. They don't have to worry about it whole of their life. Because there are side effects like they will lose their hairs, they will be having some nausea, vomiting, body ache, or sometimes there will be some tingling, numbness, and there are some skin changes. Because of radiation, everything goes away. So, and followed by that, they should take care of the stuff like, because once surgery done, there is some cut, there is some muscles, they will not be able to make the breast as original which was there. So they have to keep doing the exercise, one thing. So because if there is lack of exercise, in that case they will develop some frozen shoulders, or there can be some fullness in the hand. So most important is to continue the exercise lifelong of the hands, which is every time taught just after surgery. One thing. Then second thing, because we give hormonal treatment, so there can be some stiffness in the joints. So what we advise is that to continue yoga, stretching exercises, so that they will not be having those bone related issues. They should take calcium, and rest of the things. If there is any tingling, numbness, or something which is persistent, in that case we advise acupressure also. Now, important aspect is that yes, breast cancer is curable. Stage 1, it is almost like 98-99% of the patients are cured. But then 1 to 2% patient, they can have recurrence, and this recurrence rate increases subsequently according to the stage. So they should be under regular follow-up. So it is like every 3 monthly. First 2 years we call the patients every 3 monthly, sometimes with investigation, sometimes for just general examination, and they should follow it properly. And followed by that, for next 2 years it will be 6 monthly, next 3 years, and then it is annually. So the patient should be under regular follow-up and follow the instructions of the doctor. And whenever, even if like after that, a month back she was fine, every investigation came out fine, but then after a month she felt some lump, so she should also be aware of it, and then she can go to the doctor right away. Or any symptoms like any body ache or something like that, any abnormal, any unusual thing, they should go to the doctor right away.
Thank you so much, ma'am. My next question is from Dr. Sushant Mittal. So, sir, as genetic history of breast cancer plays a very major role especially when it comes to gynecological cancers, as they say. So, can you please explain our audience why it is so relevant to, get screened if there is somebody with cancer in the family? One, and when it is recommended for people with history of breast cancer.
So breast cancer and ovarian cancer are two most common cancer which are genetically transmitted. And it is not necessarily that all patients will have these genetic transmission. If suppose a lady has a breast cancer and we do some genetic test in ovary, we do HRD testing, and in breast we do BRCA test. And there are two type of tests in that. One is which is done on the biopsy of the tissue, and other is done on the blood sample. If blood sample is positive, then we need to evaluate the next generation as well कि यही जीन ब्लड के थ्रू जीन्स के थ्रू नेक्स्ट जनरेशन में गई है कि नहीं गई है. उस केस में आप पेशेंट की बहन को या उनके बच्चों को उनको अपने टेस्ट रेगुलरली कराने चाहिए. एंड यूजुअली इट इज सेड दैट इफ द पेशेंट हैज डिजीज एट 55 इयर्स एज, देन उससे 10 साल पहले यानी 45 इयर्स पे उनकी डॉटर्स को या उनके जो कंसर्न सिस्टर है उनको उस एज पे जल्दी मैमोग्राफी स्टार्ट कर लेनी चाहिए, सेल्फ ब्रेस्ट एग्जामिनेशन करना चाहिए, एंड डेफिनेटली वो जर्म लाइन टेस्ट उनको भी कराना चाहिए ताकि हम उसको टाइमली डिटेक्ट कर सके और उनको प्रोफिलैक्टिकली गाइड कर सकें कि क्या उनको करना चाहिए. Second is that if the patient has breast cancer, then we take a history whether any of the females relative or even the male relatives have some kind of cancer in the history in the family. Sometimes they say कि नानी को कैंसर था, वो पता नहीं किस चीज का कैंसर था, क्योंकि उस टाइम जो हमारे पास एज ग्रुप के लोग आते हैं उनकी नानी मे बी दे वर वेरी ओल्ड एंड उस टाइम इतनी डेवलपमेंट नहीं होती कि वो बता सकें. वो यही बोलते हैं कि पेट का कैंसर था. कुछ लोग होते हैं जो कि बता देते हैं कि ब्रेस्ट का था या चेस्ट का था या ओवेरियन कैंसर था. उन केसेस के अंदर हम डेफिनेटली वी रिकमेंड दैट दीज टेस्ट शुड बी डन to see if there's any abnormal gene running in the family or no. And we have now genetic counselors, geneticists who pre-test and post-test counsel the patient and the relative, because a lot of anxiety is associated with such tests and the results. And these tests are not 100%, but they give a fair idea whether the family has these carrier mutations in them or not.
So, sir, when people use the term predictive oncology, is it same or does it mean different?
No, predictive oncology more or less for this audience means same, that we are trying to predict whether you have the cancer or no. Also in predictive oncology, we try and find out what is the benefit of giving chemotherapy to particular kind of patients in early stage cancers, whether these patients will benefit from further chemotherapy or no. But for the general population, yes, predictive oncology means we try and find out through genetic test and molecular oncology whether the next generation or the current generation is affected through this genetic abnormality or not.
Thank you so much, sir. I will take the next question from Dr. Piyush Bajpai. So, sir, hormone receptor status is a term that is very widely used when it comes to breast cancers. Estrogen and progesterone receptors is often mentioned in breast cancer discussions. So, how does these receptor status influence the treatment decisions, and what should patient know about this in aspects of diagnosis? So you are on mute.
Yeah. Estrogen and progesterone receptor are basically receptors on a normal cell in breast cancer tissue. So these are present basically on the surface of the cell, and once the respective hormones, estrogen and progesterone, bind to these receptors, they actually trigger either cell multiplication or cell division, or the cells basically carry forward their metabolism. In cancers, basically, which are estrogen and progesterone positive, these receptors are drivers. These are the, you can say, generator of multiplication. So these are basically fuel for the cancer to multiply, and because of that, once the driver is there, these cells keep on growing in size. Once you cut off the driver, basically you see that these cells start to die, and eventually the tumor size would, or the swelling size would decrease. So basically these receptors can be blocked, and there are certain medications, tablets, which can actually block these receptors. To start with, it was all discovered almost 100 years back that once the ovaries of the female are removed, the breast cancer, it was seen that the tumor shrunk in size. So these hormones are primarily produced in ovaries. So basically cutting down these chemicals, the estrogen and progesterone, in terms of their quantity, or not letting them bind to these receptors, actually is sort of therapeutic. This also, once we find estrogen and progesterone receptor positive, it tells us how are we going to treat. That is, we will use certain hormonal tablets or intramuscular injections which will prevent these hormonal binding. Or also it tells us information that these are the subtype of cancers where probably you can omit chemotherapy and treat primarily with hormonal therapy. Also, it gives us information that these are the cancers they would do in general. I'm just saying that it's mostly in general. These would do better than other cancers who are which are estrogen and progesterone negative. So in a nutshell, it gives us three information. One, you have treatment options when you get estrogen and progesterone, and largely the treatment option is in form of pills. Number two, you get an insight that you can go away with chemotherapy in most of the patients, not all. Number three, it gives a certain idea that how the patient is going to fare overall.
Thank you so much, sir. So in this very last segment, I will take one more question from Dr. Abhishek, and then we will have two common questions for all our panelists. So, Dr. Abhishek, in recent years, we've seen advances in breast cancer treatment. And, with every year and with every 2, 3 years, there is advancement that we are able to see. So, such as targeted therapies and immunotherapies. Could you please provide insights to these advancements and their impact on patient care for our audience that is watching?
So, targeted therapy has revolutionized basically the treatment outcomes in breast cancer patient, and the subset Dr. Devesh Goel, he was mentioning about the subtypes of the breast cancer, depending on the ERPR and HER2 status. If the patient is having HER2 positive status, either along with the hormone positive or HER2 hormone negative, in those patients, we have a target available which is going to give benefit to these patients, and we call it as anti-HER2 therapy, trastuzumab, which was the first target therapy started. It was started using in breast cancer patient, and trastuzumab has actually changed and completely, it has increased the survival rates of those patients who are HER2 positive. By using this targeted therapy, we can prolong the survival benefit. We can give the survival benefit to the patients, and then multiple other anti-HER2 therapy are available, which can be used along with that. Initially, it was trastuzumab. Now there are double anti-HER2 therapy which can be used, pertuzumab and trastuzumab, and there are a few other. And every year the cancer treatment is revolutionizing. It is changing, and further new drugs are coming up. Recently, TDM1 has come up as a target therapy in breast cancer, and all these patients are going to definitely have benefit by using these drugs at a particular time whenever it is required, and as the guidelines says. Recently, immunotherapy has shown benefits in almost all solid tumors, and even in the breast cancer also. It was studied. Initially, it was with the triple negative breast cancer, which is TNBC, where all ERPR and HER2 they are all negative. In those patients, it was started way back 4 years back, when in the stage 4 TNBC patient, it was used first time, and pembrolizumab is the drug name which was being used. And then later on, in the early stages, also in the triple negative subset, we have found benefit by using these immunotherapy drugs along with the chemotherapy drugs. So these are the new area which is being studied, and further studies are also going on to explore the immunotherapy options in other subtype of the breast cancer. But till now, we have recommendation only for triple negative breast cancer for immunotherapy.
Thank you so much, Dr. Abhishek. So next question is a common question to all our panelists. So as we are talking about awareness and essential aspects around breast cancer, so there are communities of remote or underserved areas wherein access to specialized breast cancer care is very limited. So from all our esteemed panelists, what would be your suggestions in improving the access to screening or awareness around breast cancer that we can do, that can be looked into, starting from Dr. Safalta?
One thing that is screening part, self-breast examination is very, very important, because the issue is that even if you tell a patient, tell people that you should get a mammogram done, even the people who can avail it, who have their company policies, they are also not getting it done. So it is not about only village. It is there at every state, even well off and big lawyers. There are doctors as well. They are not getting it well done. So most important is they should be aware of themselves. So self-breast examination, it can be taught to everyone. It should be there in the curriculum in the school also, that, and we can go to all the colleges and just teach how to do the self-breast examination, and they should be aware of what are the symptoms of breast cancer. So then whenever they feel anything, they'll be able to reach out to the hospital. any nearby centers. This is most important. Yes.
Thank you so much, ma'am. Dr. Piyush, sir, your thoughts on the same.
Yeah, the more we should be actually emphasizing more on self-breast examination, as Dr. Safalta rightly pointed out. There should be public health policies. There should be individual understanding. So, I mean, in between are a lot of verticals which can be adopted. So, right from public health policy, of course, that the policy should be that, to make it a part of school curriculum, as Dr. Safalta said, or college curriculum. That girls should be taught about self-breast examination somewhere during their any course that they are taking. So that should be an essential part. So that can actually bring up very small and early stage cancers and really drastically bring down the mortality what we are seeing. Of course, the more we talk about lifestyle changes, positive lifestyle changes, the lesser it is because we are seeing definitely obesity setting in and metabolic diseases setting in. So cancer is primarily, as what Dr. Abhishek said, that 30% paper coating cancers are preventable. Most of them would be linked to metabolic syndrome. So this is very important to understand that the more we talk about it. And of course, the other thing where a public policy as well as a private partnership both can take place is encouraging health insurances. Health insurances should also make things mandatory, as in what we talk about making annual mammogram starting from the age of 45. So this should be also a part of renewal of the insurance policy, that health checkup is basically done after a certain age. And this would actually make sure that eventually the customer who's taking the health policy sticks to the needful screening tests. So that would, make this thing. And programs like yours, as well as awareness, is, of course, the more we talk about it, the lesser it is.
Thank you so much. Dr. Sushant, if you would like to add anything on to this.
I think most of the points has been well covered by my dear colleagues. I would just suggest that cancer is not a death sentence. Please don't be afraid of it. Don't read Google. Don't go to YouTube. Don't talk to your half-baked knowledge relatives and neighbors and all those who are in your satsang committee. They have all those half-baked knowledge. Don't talk to them. They create a lot of confusion. Talk to your doctor. Talk to your physician. That is more important.
Thank you.
Second, get an insurance. Not only for cancer, for any of the medical issues, get an insurance done. Nowadays, treatment is affordable, but you need an insurance. Many people come to us thinking that हमें तो कुछ हुआ ही नहीं था, हमने कभी सोचा ही नहीं था, अब जरूरत पड़ रही है. So get an insurance done. And I think it should be at least 50 lakh rupees. 50 lakhs insurance doesn't cost much if you start early in your life at 24, 25 years or whatever age, 18 years age, whatever you can start saving for that, and you should get an insurance done definitely. And that's it. That's, I think, the takeaway message added.
Thank you so much, sir. So with this, we come down to the end of a very insightful discussion on the topic of essential questions if breast cancer touches your life. I would like to thank all our esteemed panelists, Dr. Safalta Bagma, Dr. Sushant Mittal, Dr. Piyush Bajpai, Dr. Abhishek Kumar Singh, and Dr. Devesh Goyal for taking out time and imparting us with wealth of knowledge and this information. Thank you so much. We would also like to thank Dr. Reddy for this brilliant initiative of raising breast cancer awareness. Thank you so much. With that, we wrap up this show. Stay happy, stay healthy. Bye-bye. Thank you.
Thank you.
Thank you.